thank you. And it's funny, this is for the future of healthcare, and I bet I have the oldest cell phone in the room. Flip phone. I really like that presentation on, was it Friday, for the people who don't have smartphones? And I'm like, yes, that's me. All right. So I'm really excited to be here today to share with you the work that we've done so far on our NIH information resource grant to reduce health disparities. And in a nutshell, what we're doing is engaging our community to create new and better health images by playing a fun game. So we are going to start off with a little game ourselves here. Here's a pictograph. Tell me what this is. Chicken pox, yes. But could this also be a warning about a deadly chicken who will go and peck you all over your body? I mean, the chicken is looking straight at you, pretty confrontational and bold, looks like he might do that kind of a thing. And when we tested this image, we actually had responses about anxiety. What did that chicken do to that man? And we also had confusion. Was this bird flu or something like that? We found out that the association of chicken with the name of the disease made no sense to those whose first language was not English. So here's another one. It's a little harder. Any guesses as to what this is? This one is actually breathe in and out quickly. But some of the responses we've had for this one, you can think about these poor graphic designers. How on earth are they going to depict this, right? So some of the answers we've had are breathe, breathe quickly, inhale quickly, exhale quickly, rapid breathing, breathe in and out and watch for rabbits, look and breathe before you jump, while looking, put something in the mouth, cough, running, and use a breathalyzer. So obviously we have our work cut out for us, right? I love this cartoon. Doc, enough with the English. Just give it to me in plain academic medical terminology. And I'm pretty sure that that's an anomaly. And what's more common is this. There's the provider talking to their patient, using medical jargon, and it just all sounds like gobbledygook to the patient, and they're very confused. So obviously, a lot of health information, verbal, written, and illustrated, is presented in ways that make it really hard for the consumer to understand and use. And low health literacy is a really big issue. It's pervasive and really under-recognized in healthcare today. According to the most recent data on literacy in the United States, nearly 9 out of 10 adults have difficulty using the basic health information that they need to take care of their health and make decisions. And that seems like such a huge percentage of us. How can that be nearly 9 out of 10? Well, if you're thinking about it in terms of just being able to read something that your doctor hands you in the office, maybe that number seems out of whack. But what we're really looking at is the ability to find, understand, and then use or act on that information that you're given. And even the most otherwise literate person can have a really hard time understanding medical terminology and complex medical terms and ways of handling their disease and taking care of themselves. I mean, if you think about some of your own experiences, could you decipher your last hospital or office visit bill? Have you tried helping your parent or grandparent sign up for Medicare and going through all of those forms? Or you might have several chronic diseases and you're trying to manage those with several prescriptions that you have to keep track of. And you can see how this can be an issue for a lot more of us. So who is most at risk? Older adults, people with a poor health status, and immigrants struggle the most. And in these populations with lower health literacy, we see higher rates of chronic disease, poor overall health outcomes, and higher mortality rates. And so our research group is focused on looking at the written materials that these high-risk groups receive, things like discharge instruction, medication information, and patient education information. And we know through research that adding illustrations to written materials can significantly increase comprehension, recall, and adherence. It can narrow the gaps of comprehension between those with high and low health literacy, and it can even compensate for limited non-native language proficiency. However, developing those illustrations that are culturally sensitive, informative, and accurate is really challenging, as we saw with those first two pictographs. A picture can mean many different things depending on your cultural background. One person that we had in a focus group took a look at this picture with a man and the turtle down here and said, only white people would walk a turtle. And that was a joke, obviously, but really pictograph recognition is population dependent. And race, education, and first language all affect that recognition. But how do we know that an image successfully communicates the intended message to the intended group? And how do we know a pictograph adds value to the information as not just like a useless little thing taking up space? So the design, test, and redesign process that we use to determine those things is really time-consuming and costly. And creating the custom-made pictures is also time-consuming and costly, and it requires graphic design skills that most clinical and research teams usually lack. And there aren't any comprehensive, high-quality pictograph collections for the health domain. No little graphic images that you can plug in for things that are going to be really helpful. And there isn't any evidence-based research showing which images are best for a particular patient population. But we're working to change that. So our grant, we were awarded a 3-year grant, $91,000 from NIH and the National Library of Medicine, which is going to run through 2016. And the information resource grants to reduce health disparities were awarded to projects that could bring useful, usable health information to health disparity populations and to the providers who care for those populations. The projects had to combine the use of computer and information technology with health sciences libraries to deliver that information. And our team is made up of experts in consumer and patient health information, visual communication in healthcare, participatory design, and working with initiatives targeting underserved populations. And our grant work builds on the work of our principal investigator, Qing Zhen, who is a bioinformatics professor at the University of Utah. And previously, she's worked with graphic designers to develop a pictograph collection of health images that are over 600 images strong right now. And while the pictures have had some evaluation, they haven't been extensively tested by minorities. So this grant will allow us to simultaneously test and validate the images while significantly increasing the size of the pictograph collection, which is going to be made available freely to any and all healthcare providers. It's not going to be a licensed resource at all. So for our methods, participatory design, crowdsourcing, and gaming have been used successfully in other domains, but not in the area of patient health information. So we were really excited to apply these methods in our grant. Local minority groups would help us design the game, telling us what health concerns to focus on and what technologies they have and what game would be most of interest to them. And our assumptions was that by engaging the minorities in the production of the education materials that were intended for them, that we would end up with things that would be more meaningful and useful and relevant. Crowdsourcing would be used to create and test the pictures. So anybody who played the game would be able to propose new pictures. They'd be able to make improvements or alternatives to existing pictures, and they'd be able to test the recognizability of the pictures. And crowdsourcing is what really makes this whole thing tractable in terms of time and resources. So we're getting away from that costly, time-consuming challenges that we've had up to date. And turning this into a game just provides a richer, more meaningful, or at least a much more fun way for engaging in research. And just by playing the game, people are providing information that's directly usable. So this probably won't come as a surprise to you, but Utah is not the most diverse state in the United States. So that is why we were really fortunate to have 2 established community minority groups to work with. We have Community Faces of Utah, CFU, and we have Utah Women's Health Coalition for, no, wait, that's not right. The Coalition for a Healthier Community for Utah Women and Girls, which is UWAG for short. And forming a partnership with these organizations ensured that we were going to have a culturally diverse group for the crowdsourcing participants. And it ensured that we'd have champions that would endorse this project to their communities, and we'd get people really excited and involved in playing this game. So CFU is a coalition representing 5 underserved communities in the Salt Lake Valley. It's African American, African refugee, Hispanic, Native American, and Pacific Islander. And this is their mission. I'm going to read it verbatim because it's just wonderful, and you'll see why we wanted to partner with this group. CFU believes it's important to make informed preventative healthcare decisions for ourselves, our children, our families, and our friends, and that by increasing knowledge, we become empowered to improve health for our families and our community. We also believe that diverse community organizations and institutions can fruitfully dialogue and collaborate to build trust, learn from each other, and work together to enhance the communities of our health, to enhance our community's health. And the other organization, UWAG, was developed as a 5-year NIH participatory research grant to test the effectiveness of healthy lifestyle interventions delivered through community wellness coaches. And since we knew we weren't going to be able to make the game available in multiple languages immediately, we really wanted to take advantage of those community health coaches that could possibly sit down with people individually and translate things for them as they're going through the game. So in the first year of our grant, we conducted a focus group with the CFU members in order to ascertain their leading health concerns in their community, their use of technology, and their gaming interests. And their leading health concerns were the chronic diseases most common in their communities, namely diabetes and heart disease. But they were also really interested in promoting just general overall health and wellness lifestyle choices and behavior information too. Let them know what the side effects were of not paying attention to their health. They noted that socioeconomic status is a crucial factor to the health in their communities, and they wanted information about financial resources and education about the health insurance marketplaces to overcome some of those economic barriers to care. Participants pointed out that they were less concerned about their own health and more concerned about the health of their children. And they also noted the need for cultural sensitivity, since some health images or topics were offensive or culturally taboo for some groups. As for technology, we were a little surprised by this. They said that most people in their communities had computer access at home, or if not, at least had internet access on a smartphone. The smartphones were pretty pervasive. So obviously, I do not fit in with any of these groups, so you need to help me. So that said, there are limits to technology access. They might have fewer minutes on their phone, so they're going to be really particular about what they choose to access. Affording that technology was a priority for them. They'd often go without healthier foods so that they could afford their smartphone or internet access. As for the game to be developed, participants wanted to be challenged but not taxed, and they really liked social and competitive aspects in a game. And they provided a list to us of games popular in their communities. And when we brought up something like Pictionary, we got a bunch of blank stares. I guess that was from too long ago, or not quite as popular as we thought it was. We were really showing our age. So maybe we could bring it back retro, style. So we took the results of our focus group to Roger Althusser, who is the fantastic director of the game design and production at the University of Utah's prestigious Entertainment, Arts, and Engineering program. It's the #2 ranked game program in the States, and I can't tell you what #1 is because we don't pay attention to that. But Roger facilitated 2 design box sessions for us, one with our grant team and one with the CFU members. And this was a new method of brainstorming that I hadn't been introduced to before. It's pretty neat. We put up the 4 constraints around the sides of the box for our audience, the aesthetics, the technology, and then the overall question that we're trying to solve. And it was a lot of fun, and it provided an opportunity for all the stakeholders to get involved in the game design process. And it gave Roger and his team a deeper understanding of our research project before pitching any ideas to us. So we're really, oh gosh, that's really glary. Sorry about that. We're really fortunate to have at the University of Utah the GAP Lab. And these are a group of graduate students from the Entertainment, Arts, and Engineering program. GAP Lab stands for Therapeutic Games and Apps Lab, and it's a partnership between the University of Utah and University of Utah Healthcare to develop therapeutic games and apps, both for university population and then outside of that. And the students work on semester-long projects, managing deadlines and budgets and meeting with their clients. And some of the projects they've recently developed have included a video game called Reflex Speed for athletes that combines brain and body training to improve their performance, and a game to help reduce anxiety that kids feel when they visit the optometrist. And it stars Oppie, who is an ophthalmosaurus, and which I found out was the dinosaur with the largest eye-to-body ratio. So one of the great things about working with a student is that they have to have their work finished in that semester. So in this case, it was the summer semester, May to August 2014. The total cost for working with the team came in at $30,000, which covered the salary and benefits for 5 grad students, 2 faculty members, 1 staff member, at 20 hours a week for the 12 weeks. And the GAP lab is actually conveniently located in the basement or the garden level of the Eccles Health Sciences Library on campus. So we have all these guys down there on the bottom floor, and they frequently are running around with like Nerf guns and all sorts of stuff. It's great. So the designers created 2 versions of our game for research purposes, and one is called Drawing Health, which specifically was designed for the 5 CFU communities, and then the other is Doodle Health, which is for the general public. And since the competitive aspect was something the focus group participants said they really liked, the designers decided to have players identify with a community team in order to start playing, and the scoreboard shows the progression throughout the time of that session. And that also allowed us to capture the cultural information that we wanted. And we have an admin end on the backside of both of those versions of the game where we moderate all incoming drawings, track statistics, and review and generate data. And the designers used a combination of HTML5, JavaScript, and CSS as their development tool, so the game could easily function in multiple browsers without requiring any additional software installation. And so here's the results. In 12 weeks, the designers delivered this fun, attractive game that could be used on a phone, tablet, or laptop. And it's like drawing something, if any of you have played that, but with an altruistic purpose. You get to participate in science, and you get to share your ideas and contribute to the health of your community. And it's colorful and fun, and it's not academic or research looking at all, not scientifically intimidating. The designers used a 4th grade reading level. They have large, clear buttons with common icons so you can know where to start playing your game. And it's still very much in beta, but we just took it to one of our health fairs where we get thousands of people from the community coming in, and the overall response was pretty favorable, and they had a good time playing the game. Just quickly to wrap up what we're doing next is year 3 of our grant. We're going to be devoted to testing the game with our key partners, promoting it for general crowdsource use, collecting the data, and evaluating the effectiveness of the pictographs. I am going to, let's see, I guess I have a couple seconds. Okay. We already know some of the things that we want to enhance on the game. We want to be able to play up the competitive aspect and make sure we can tie in individual scores and track that so people can show people what they did for their drawings and how they contributed. We also want to test this with our clinicians to make sure that it actually has a good effect for patient outcomes, looking at provider satisfaction with the images as well as patient recall and understanding as the metrics. Ideally, we just want this to enhance communication between provider and patients and lead to better outcomes. And here's the link for the game. I was really hoping we could click on there right now and you could test it out. Basically, what you do when you open this up is you choose your community. Right, when we do this for the public access, this will be changed to choose your cultural background or something like that instead of community, because that doesn't make as much sense. Then you have an option to either draw or guess. And the guessing option is there for people who don't feel comfortable with their drawing skills, but it's not as much fun. But when you go in there, you choose easy, medium, or hard for your level of difficulty. Easy might be something like cook or something, and then a harder level of something to draw would be excess belly fat or something like that. Some of the concepts are pretty tough, like how would you draw cool down for stretching or something like that. And the drawing option is really neat. You can either use your finger or you're using your mouse to go in there and do it. There's colors you can add, and then when you're satisfied with your drawing or you're satisfied with your guess, you submit it. You get this, wow, great drawing thing. You see how you've contributed to your cultural community on the score level, and then you get to go in and do another one. And if you've gone in to guess something, and you decide, oh, I think I could do a better drawing than that, then you're given that option to go in and draw that same thing that you just guessed as well and submit that. So I hope you will all check it out and give us your feedback. And like I said, it's still very much in beta version. We have some things to change and enhance, but keep track of it and hopefully you'll enjoy playing it. Oh, sorry, let me go forward to that. It's actually just doodlehealth.com. And then there's drawinghealth.com, which is our interface that we're using with our Community Faces of Utah groups. So please send us your feedback.
Great, thank you. Questions for Erica? We have basically a minute or so. Yes?
One quick question. Is there any normative data that helps you pictographs you create?
Well, Dr. Zhang's previous work, she focused a lot with patient discharge information for cardiovascular patients and then medication information. So the pictograph library that exists right now is fairly substantial in those areas. And then from our focus group, we knew that they wanted things that looked at diabetes and cardiovascular disease, but also just general healthy lifestyle living. There's a group in Philadelphia that we're also partnering with, and the group is similar to Community Faces of Utah, and they're also very interested in just general healthy lifestyle information. So, and that's the stuff that's really hard to draw or to illustrate. So we're looking forward to developing options for things like that. Mm-hmm. Yeah, we didn't have any idea of what this game would look like when we started the grant at all. We wanted the people from the Community Faces of Utah and our UWAG group to help us design that game. We wanted it to be something that they would play. So what better way to do it? And so that's how we got all those ideas out there and then started narrowing it down. And then the gaming group that we worked with at the Gap Lab, they were the ones who put all those things together and decided, oh, here, we'll meet everybody's needs and wants and desires this way.